Welcome to Payment Matters. I'm your host, Jeff Lin. Thanks for tuning in. On this show, we talk about the ever-changing landscape of healthcare payments and the impacts to healthcare payers, providers, and consumers. You can follow the conversation on Twitter at hashtag Payment Matters and follow me at Jeff Lin. Really excited today about today's guest. He's Brandon Baldock. And Brandon is the Director of Revenue Cycle Systems at Epic. Brandon, it's great to have you as a guest today. And thank you for being with us. Maybe just for our audience and our listeners here, can you tell us a little bit about your background and experience?
Sure. Hi. Well, it's great to be here. So my background before being here at Epic was in math. And it's funny, when our founder, Judy Faulkner, gives her introduction of Epic to groups that come to visit us, she often starts with her background and says, I have a background in math. Does anyone else have a background in math? And I always have to raise my hand. I'm not actually sure she wants to keep hearing from me in those informal surveys. But anyway, I started after doing graduate school in math. I started at Epic in '98 doing implementations of our revenue cycle systems. And I've been here in the revenue cycle ever since. But now I work in product management, and I work with all of our revenue cycle products and focus on the patient financial experience.
And Brandon, maybe for listeners who may not know too much about Epic, maybe describe a little bit about what Epic does and what does it do for the healthcare community?
Yeah, so Epic is a platform for healthcare that focuses on everything that touches the patient. I think in some circles, Epic's probably most famous for MyChart, which is the patient's access to their medical records for test results, patient's access to their medical records for test results, and revenue cycle things as well, right? So secure online payments and things like that. In the healthcare community, I think Epic's most famous for the medical record software. But in our space, we really focus on the revenue cycle, and we've had the industry's leading hospital billing and professional billing revenue cycle systems for many, many years now.
You indicated in your bio that you're in product now. You've been working in revenue cycle there. Maybe for our listeners, what does that mean? What are you working on specifically today with respect to the innovations that you're working on with Epic? And what excites you right now?
Yeah. Well, as I mentioned, the thing I'm focused most on right now is the patient financial experience. I spend most of my time in that area. And I'm really excited about what we've been developing. The community of users, of healthcare organizations is doing with the stuff that we're making. So we had a big transformation in 2021. We went completely digital first. So we're trying to eliminate the old statement cycle. We've been paperless for a long time, but now this idea of, well, let's communicate digital first to the patient via their preferred communication channel, text, email. And so we had our first organization go live and launch this in November, New York Presbyterian and Weill Cornell. And it was exciting. In the first 2 months, they saw that the digital notifications they sent out, 15% of them got paid in full within 3 days, and they never had to send a statement. So we're excited about that. I'm excited about our new Autopay. So this is this idea that when I send a notification, or when our patients start their visit, that they can agree that they'll pay automatically up to a certain amount. So then when we send our digital notification, we can say, it's all taken care of. You already agreed. Your card is just going to be charged for this amount. So it takes that process of what's the exact amount that we're going to charge, but we want to be proactive and try to get that payment up front. And it just takes away all of the friction from it.
I want to talk about the notifications aspect here. That's an amazing stat there. And why do you think healthcare is so hard or different in terms of that patient experience? What makes it unique that maybe people don't understand?
Yeah. Well, healthcare is way more complex than people outside of healthcare know. And it's funny when we get out of healthcare know. And it's funny when we get people to come into it And, there is a lot of that right now where, people who have come from retail and other spaces that have their own challenges, but now they come in and they say, well, I'm going to be the chief digital transformation officer of this healthcare organization. And they pretty quickly realize there is a lot. Healthcare, hospitals are like cities with all kinds of different ways that patients are interacting. And I think one of the real complexities is that we're always protecting their personal health information. So we can't just text people and say, pay for your colonoscopy, because then we just, sent out a text about personal health information. So that's actually one of the things that we've been, that was the other huge transformation for us in 2021, was that we realized there is actually a lot more that we can do than we have been doing. Method on file with my healthcare organization, because the last time you were in here, you said, and paid, you said, save my card for the next time. Then I can send you a text and I can say, you have a balance of 125 and click here to just pay it with the card ending in 1234. And I haven't actually sent you anything that would disclose any personal health information, but we can get that transaction done quickly and easily. So I think that's been the evolution. I think the pandemic has really helped accelerate it. It's really forced us all in this industry to maximize what we can do while still protecting personal health information. So that's the obstacle. I think that's the biggest one, besides just the complexity of all the different types of services that are encompassed in healthcare. So,
how do you approach these problems here from a product lens? How do you know where to invest or where to focus on to really address your client needs?
Yeah, it's remarkably easy. Our customers really tell us where we need to go, and all we have to do is keep up with them, right? So we have an incredible community. Healthcare in general, it's a very tight-knit community, and all we have to do is listen, and we know where to go. It's funny, our founder, Judy Faulkner, says, she compares it to the yellow brick road. She's like, all you have to do is follow the yellow brick road. And I think it's because it's laid out. It's pretty clear. It's a tight-knit group of people in this industry that know where we want to get to and know the challenges to get there. So then the innovation is really, how do we overcome those challenges?
That you're seeing, are they more systemic for the macro healthcare, or is it like challenges in terms of adoption, right? Like all the big technology companies are trying to get into healthcare, large acquisitions, et cetera here. How come things aren't magical like a ride-sharing app and I can step out of the ride share, it pays automatically? Why are things moving slower, faster? Like, what do you see as the headwinds coming out of this?
Yeah, I think, again, some of it is just it is a really complex industry, and you have to be in it for a long time to know how to navigate it. So when we look around and we look around at the vendors that have provided information technology in this space, it's the ones that have been dedicated to healthcare the whole time that have been successful at providing solutions for groups. It takes time, it takes knowledge. There's a real barrier to entry just to understand the needs of the industry. And it's not an industry that lends itself to quick, commercial, profit-oriented public companies, right? So I think that's part of it.
You highlighted the patient financial experience. That encompasses a lot of things. And what is the patient, like how would you define the patient financial experience? What is that from a product journey, from a customer journey? Like how do you view that? How would you explain that?
Yeah, it's interesting because I lead a monthly webinar for our user community on the patient financial experience. And the way we talk about it is the patient journey. It starts with, maybe a person in the community isn't even a patient yet, but they may be shopping. I'd like to get my knee replacement. How much is that going to cost? I'm worried about it. Well, that's, now we're into the patient financial experience, and we don't even have a patient yet. So we really say that the patient financial experience is woven into every step of the journey. And there's been a lot of focus on transparency and surprises, and that is a big part of the outset of the journey. So we try to provide tools that, self-service tools, easy to use tools that, it's not just about, there's a lot of regulation around this now too. So we need to comply with the regulation, but it's for the right reasons, right? That we want to provide patients with that knowledge of, if I do this surgery, what is that going to cost me? What are my benefits? And then along the way, that journey evolves into, well, now I have a visit for a consult, I have a surgery scheduled. So how do I arrive at that visit? And as I arrive, how are we, or get ready to arrive? How are we checking my insurance? Can we do that online? Can I upload my insurance card without having to, do that at the front desk when I arrive? How do I do that without having to go to the front desk? If I can prepare ahead of time online, I can have a contactless arrival. In the exam room, as we're ordering that test that I'm talking about with my physician, can my physician tell me how much is that test going to cost me? And so we provide tools at every step of the way, because we think that's what we're looking at. When we describe the patient financial experience, it's the journey from beginning to all of the things then that after the fact that we think about readily are, the bill pay experience and setting up payment plans and that.
One of the questions I have, we hear this all the time, there's a lot of paper in healthcare, from the bills, from me coming in, checking in, filling out, reams of paper here in order to, and sometimes it's the same family history that I filled out, a month ago, right?
Mm-hmm.
And you highlighted at the very beginning, which is digital first, getting those patients to be thinking digital. Is that a hard thing? I think there's been a lot of customization to I've been doing it this way. How do you overcome potential patients or healthcare organizations not wanting to be digital first? Has that been an issue at all?
Yeah, so a few things here. Some of it has been that if you think about healthcare, another way of thinking about it is it's all these different verticals, right? So healthcare, another way of thinking about it is it's all these different verticals, right? So it's hard to design a tool that says I'm going to get all this paperwork done in advance of a healthcare visit, because there isn't one kind of healthcare visit. So some of it is on us as the suppliers of this technology to create these verticals that work in all these different settings. Like if you're going into the emergency department, then we can't talk to you about all the paperwork around your insurance, digitally or otherwise, until we make sure that we've triaged you and that you're stable and we can have that conversation, which makes a lot of sense. Versus if you're preparing for an elective surgery, well then, we've got time and we can handle this, all this paperwork in advance, way of going digital. So I think some of it is on the vendors. Some of it has been on healthcare itself to say, I don't need to have that signed on a piece of paper. It's okay. We can sign things digitally. And unfortunately, it took a pandemic to some extent for everybody to say, well, now we've got to try it. Now we've got to try getting that signature electronically only. And lo and behold, it worked. And everything's still going well, better than ever in some respects from that perspective. So yeah, there was some hurdles as far as momentum, and the pandemic helped us overcome some of that momentum and really accelerated the pace of change from a digital standpoint.
If you're just tuning in, you're listening to Payment Matters. I'm joined by Brandon Baldock of Epic, and we're discussing healthcare payment experiences for patients. And so, Brandon, this is interesting here as I look at this, and I want to reference something you said earlier, some innovations that you're working on. One is the Autopay features, and a lot of that when I think about that is in terms of Autopay, it's probably linking in, telling the patient how much they owe or how much they could actually pay, and then kind of automating that workflow after the claim adjudicates there. Maybe you can describe Autopay a little bit more detail and maybe the results you've seen with your clients when that's been launched.
Yeah, so we're really excited about this one. So this one is going to be exciting to see what customers do with it. It just was released in November of 21. And we're seeing a huge number of our organizations are going to upgrade to that release of Epic software in around April timeframe. About 223 organizations across the country will be on that release around that timeframe. So we're going to see what they do with it. And I'm really excited. I think they're really excited. And the idea is healthcare is, if you think about it, one way of putting it is it's a time and materials business, or at least a number of the areas of healthcare are time and materials. I go in for my surgery, and how long it takes is how long it takes. I might be in the OR longer or shorter. They're going to find out more when they get in there. We're going to find out how long I stay in the hospital after my surgery based on how fast I'm recovering. So it's hard to say at the outset, what's this all going to cost? So the idea of Visit Autopay is to combine the desire to be proactive and take payments up front, but still acknowledge that there's this uncertainty in healthcare built into the way healthcare is financed. So we don't know exactly, precisely what I'm going to owe. So in the past, the way this would work is I would pay my estimated balance, and then at the actual time my balance hits my responsibility, we'll know precisely what I owe, and they might owe me a refund, or I might have a balance left over that I need to pay. And so there's all this stuff still to do. So the idea of Visit Autopay, it's like the hotel flow. Nobody knows how hard I'm going to hit the minibar in my hotel room, but the hotel will charge my card, or authorized to charge my card up to X amount. They'll say, you're putting your card on file for up to $500. And then when all the paint is dry, and we're charging your card. So this is healthcare working the way the hotel industry has handled this uncertainty for a long time. And yeah, we're really excited. We think it's going to take a lot of the friction out of it for patients and for staff as well at the healthcare industry, so at the healthcare organizations.
That's really exciting. Yeah, it's great innovation here that addresses a lot of concerns that are out there. Affordability in healthcare. We're hearing more and more that these patient balances are growing, and the general populace is not able to pay that. Is there anything that should be explored, or you've explored, with respect to those kind of problems?
Yeah, it's definitely top of mind for all the groups that I talk to. Deductibles are higher, ability to pay is lower. So yeah, deductibles are higher, ability to pay is lower. So yeah, absolutely. There's a lot to talk about in this space. I'll tell you what I experience when I talk to the groups that I work with. They're very interested in automating as much as possible financial assistance, because they know they're going to be providing financial assistance. I think healthcare is really good about providing financial assistance, but it can be a time-consuming process to decide who's eligible and get them signed up. So we've been working a lot in that space on automating presumptive charity. So that means, like, if it is obvious, according to our policy, that a patient warrants a discount, that we're going to do that automatically. We're also making it We're also making it easier for the financial counselors that are working with patients to do that in a digital way. So this goes back to that conversation about how can we get all this paperwork digitized, digital. So we've made the online experience of applying for financial assistance and supplying the necessary forms for organizations that have that process, making that all digital and online. And most recently, making that available for any patient, regardless of their status with, in the past, we've made that available because we wanted to protect not only their health information, but now we're talking about their financial information. So we have to be super careful with that. So in the past, we would do that in our online financial assistance module where my chart patients, that's organization, that I can use that. Well, as we change strategy and we say we want to make these experiences available to everybody, regardless of their MyChart account status, we've looked at other ways to verify the patient's identity using two-factor authentication, a secure token that we send them when we say we'd like you to give us this information online, and then something they have, and then something they know, their date of birth or other demographics, and then they can log in that way and get all of this stuff uploaded. I can do it with my phone, take a picture of my pay stub. So healthcare, the affordability is a hot topic. I think the other thing that I'm really proud of our healthcare organizations for contemplating is how do we be good stewards of our community? How do we keep patients out of bad debt? So there's several Epic using organizations, several members of the Epic user group out there that have said, let's not escalate the follow-up on this patient and end up sending them to bad debt if they're paying at least something on their balance. And a lot of them have said, for example, we'll accept X amount, we'll accept what we would usually accept as a payment agreement, even if we don't have a payment agreement with this patient. And as long as they're making that minimum amount or near it, then we're just going to keep that balance going, and we're not going to end up with all these people in our community being placed in bad debt. So our user community is doing in this area.
That's exciting. Sometimes that, when you say the word healthcare, you forget the word care is in there.
Mm-hmm.
And in many ways, that's kind of why, all of us and are in this business is that person, that patient, that consumer, however that is, that's the focus there. The last question here for you, which is, you've been in healthcare such a long time. You've seen many aspects of it. If you had a magic pill that could grant you any wish that could address problems in healthcare, what would that be?
Well, I'll tell you, I'll just base it on what I'm seeing right now, and as part of why I'm here doing this podcast, and I'll explain that as I think about your question. So I think healthcare organizations right now, they know they want to modernize. They're really concerned about staffing and protect, at the same time, the patient experience is part of what they're thinking about, and they're trying to innovate, and they're trying to figure this out, and they're bringing in this digital transformation officer, and that digital transformation officer is saying, I'm going to figure this out, right? We have to be allowing our patients to schedule online, to have this easy access to our digital front door. And in the meantime, I know the CIO, I know the folks in patient access at these organizations that have been trying for years, to say, we have these tools, we can schedule online, can we implement them? And there's been these obstacles, this momentum of, well, we're concerned, you might have doctors concerned about patients wasting everybody's time by making the wrong kind of visit and scheduling the wrong resource. And then in the meantime, there's those of us here in product development, on the vendor side, who know, well, we just released a new tool that goes through a decision tree and makes sure that the patient is going to get to the right resource. So if there was a magic way to get us all in the same room, despite distance and a pandemic and disparate angles that we're coming from and say, you've got the mandate to transform things digitally. We've got the solution to get over those hurdles. We can put this all together. We can change healthcare. So there's going to be people out there who know Epic pretty well, and they're going to say, what the heck is a guy from Epic doing on a podcast? That doesn't seem very epic. But that's why I'm here, is I have this goal of getting everybody together, and we can do this. So I'm getting the word out.
Yeah, Brandon, and that makes a lot of sense. I think just explaining that we can all work together, and I think in terms of the innovations that you and your team are doing, it's exciting to see this. I think it's all about industry results and moving things forward. And I don't think anyone's going to say no to being digital first. All right, I think that's always been a key thing here. So, well, those are the payment matters we're tackling today. And thank you to my guest, Brandon from Epic, for joining me today. Brandon, if they want to learn more about you or what you're doing with respect to the patient financial experience, how should they reach out to you?
Yeah, so definitely visit our website, epic.com, if you're not an Epic customer. If you are an Epic customer out there, love to hear from you. On userweb.epic.com, we have links to our monthly patient financial experience webinar. So find us there, contact your Epic person, and they can lead you there. Yeah, so that's what I would love. I'd love to have everybody who is out there who's listening, who already has an Epic user web account and is interested in this area, to the monthly webinar that we lead to give you all the roadmap and updates on a patient financial experience. And for those of you out there who are not currently Epic customers, we will see you at HIMSS. You can find us on our website at epic.com, and we'd love to hear from you in the future as well.
Remember that you can listen to this episode weekdays at 4:30 a.m., 12:30 p.m., and 8:30 p.m. Eastern. You can also listen to this on Apple Podcasts and Google Play Music, or just say, Alexa, play Healthcare Now Radio. If you have a comment about the episode of the show, follow hashtag Payment Matters, or connect with me on Twitter at Jeff Lin. You can learn more about the show at Healthcare Now Radio or at Instamed.com. Until next time, I'm Jeff Lin.